Did you know positive psychology interventions take a unique approach to addiction treatment? Numerous research projects have shown that a concentration on positive characteristics and strengths are linked to health benefits and the well-being of people in various domains of their lives. The University of Pennsylvania describes positive psychology as the scientific study of the strengths and virtues that enable individuals and their communities to thrive. Now, positive psychology is not just another wellness trend. In 1982, one of the first mindfulness interventions, mindfulness-based stress reduction, was born from a study on positive psychology, where the aim was to help provide an alternative approach for dealing with chronic pain in a non-reactive way. And for the longest time, substance use treatment has centered around identifying and eliminating negative behaviors only that rarely results in successful outcomes. By contrast, positive psychology reframes this deficit-based perspective into a strengths-based one. Instead of fixating on eliminating every maladaptive behavior, patients are first uplifted through an assessment of their strengths, resources, hopes, and aspirations. The intent here is to begin the treatment process from a position of positivity, where the patient concentrates on their future without substances, building tangible goals and achieving a lasting recovery. In one comparative study from an international psychiatric journal of behavioral science, 18 patients with major depressive disorder were divided into two groups. One group was treated with a traditional form of psychotherapy called cognitive behavioral therapy, which focuses on the development of personal coping strategies that target solving our current problems and changing our unhelpful patterns and cognitions, like our thoughts, beliefs, attitudes, behaviors, and emotional regulation. The other group focused on positive psychology interventions. The results of this comparative study showed us that positive psychology interventions were more effective in increasing happiness among patients with major depressive disorder, as evidenced by their pre- and post- Oxford Test of Happiness and Subjective Well-Being Scale. Similar results were found in patients with cardiovascular disease, cancer, and diabetes. So here are some ways that you can shift your approach in recovery from deficit-based to strengths-based. First, identify your personal strengths. These are talents, interests, aspirations, career traits, or resources that you possess. What you regard as ordinary about yourself might actually point the way to meaningful desires and goals. Even a simple statement like, "I'm a social person," opens the door to possibility. 2. Build mindfulness into your treatment experience. Try the Phoenix House Mindfulness Curriculum, a brief 8-session group designed to introduce you to mindfulness in a practical and interactive way. 3. Embrace creativity. Maybe it's art, music, dance, theater, or technical skills that excite you. You don't have to be the best in the field to do what you enjoy. And whenever you're motivated by pure enjoyment, there's a greater chance of growing your skills and using them in many different situations. And 4, take our 10-day gratitude challenge. There are 10 prompting questions that guide journaling for the beginning or end of each day. For access to these resources, connect with us by emailing learning@phoenixhouse.org. And now you know.